Hi, my name is Dr. J and we're here to talk about carpal tunnel syndrome. Carpal tunnel syndrome is basically having numbness and a change in sensation in this part of your upper extremity towards your fingers. So, anything below that is a different condition. We'll talk about that in a little bit. Most of the time, carpal tunnel syndrome affects these two fingers right here, the pinky and the ring finger. Sometimes it can involve the middle finger. Some people will have it on these three fingers or these two fingers. So either way, as long as it's above the wrist, it is carpal tunnel syndrome. Now, of course, there are other conditions that can lead to this problem. We don't want to ignore that, but we're going to talk about the simplest one. The carpal tunnel is an area underneath your wrist right here, just on that palm side, just where the wrist and the hand meet. That houses a lot of the tendons and nerves going to your hand. When we sit and type on that computer too much and we're flattening up our wrists, causing a lot of movement in the finger, that causes a lot of muscle spasm in this area, which can lead to the production of scar tissue. Scar tissue in that region can lead to tightness and occlusion of the nerves going down to your hand, which is basically going to lead to this syndrome. Now, what are the symptoms that you feel? Because I know it's uncomfortable when you do have it. Tingling as if you have pins and needles in your fingers and palm. It can be on both the dorsal side or the palmar side. Either way, it can lead to a lot of discomfort at night or while you're using it at work. So, how do we stop that? First, make sure that we have full range of motion in your hand. If you don't have full range of motion, you could have some condition with the wrist that we need to have your doctor take a look at. I always tell my patients this: make sure first that all the joints are working correctly before we find out whether there's a scar tissue problem in that area. Then we first occlude the area in that part of that wrist, press it down, and see if you have any type of worsening in those symptoms. A lot of times it can lead to that, which is going to basically confirm to us that we have this problem. Also, sometimes raising your hand just up above your head, pumping it up, will cause a lot of tightness in that area and a loss of blood flow, which can lead to that problem as well. Again, tendons, nerves, and arteries, all the structures that go to your hand come from this area. Carpal tunnel syndrome will address or basically affect all of those. How do we stop it? Stretching and breaking out